We're nervous.
Very nervous, a little pinch,
Yeah.
nothing too bad. So I always trick the patient a little bit, do a little bit of this kind of vibration effect that everybody's trying to do right now using specialized devices. You know, we started in the old days. I can say that now since I've been doing this for 10 years. I can just shake the skin and I don't have to buy a vibration device. And I'm just going to do a little bit at that 90-degree angle. It's about half a syringe injected there into the area around the masseter, and building it at 90 degrees. And by doing that, you can even see just that small half syringe, which right now, obviously, there's a little bit of fluid, but if you take a look straight on, let me just show them here. Look straight ahead. There is more of this definition from the front. Now let's turn to the side. Take a look here, 90 degree. A little bit more, and the neck will end up looking really good. So mix them into there. So the extra that's left over, I just want you to mix that back into the syringe if you can. Let's go back to somewhat tight. It's a little too tight as well.
Oh.
It's okay. I can't get you. Sorry guys, we've been mixing the little swishers. Get tight. Anyone have any questions so far, at least on the overall architecture and design of how we're going to use the fillers today?
Is that the same way you use other fillers along the jawline?
Yeah, so that's a great question. You know, my go-to fillers for jawline are dependent upon the overall look that the patient wants to go for and if they're male or female. Men always want a little bit more structure. They want it to be a little wider. Although certain celebrities have very wide faces, like Angelina Jolie, for example, that has a very squared off look. A lot of women like that look. But if you look at people like Bellafill and Kim Kardashian now, they're very oval and slender. So in certain patients, Asian patients for example, you might want to decrease the jawline size by using Botox or certain slenderization, but in males, we might want to increase the size with, I like Radius, Bellafill, Restylane, Define, and then in females, Voluma, Gderm, regular Gderm Ultra, and Restylane. So we got that defined now a little bit. We can move to chin projection now. I always tell people we gotta avoid the Jay Leno chin. That's the most important thing. And even with women, it's not always about widening the chin, it's about projection. So the angle should be that the nose should be close to the angle of the lip to the chin. So his lips are obviously very deficient. If we look at him from the side, turn a little bit here, you can see that if we drew a line directly down like this, his lip volume would be way too low, but his chin's actually pretty good projected, and so is his nose. So for him, rather than projecting it forward, we want to go a little wider to give him some masculinization in terms of his look. And we're going to go just directly down to bone, small half, but nothing crazy. Same thing, very little in the middle, because again, we're not going to try and do too much in terms of overall projection. And remember, Bellafill builds over time. So our goal with him is not to over-volumize. You may not even see the result in the initial treatment. We're going to go a little wider. The one thing to be aware of over here is the facial artery and vein cross right here near the marionette area. So when you're injecting here, especially something permanent, it's better to go slow. Potentially you can pull back, although I really do not feel that pulling back does that much unless you have a solution like a sculpture, for example. The majority of the time, if you actually pull back something viscous, it's rarely going to show you anything. And then for the cheek in a male, we try not to go laterally too much. However, if we drew a line directly down from the lateral canthus and then cross that line with the mouth, we will know where his main mid-face volume should be. And just above that is a great place to give a little highlight to the cheek to give the male a little bit more masculinization in terms of the projection there of the cheek. We're going to go just a little bit more anterior, very small, 0.1, and then a little bit more superior. We don't want to move lateral. And that little enhancement, we just turn slightly. Right now, obviously, it looks like little bumps, but that will highlight, and this will highlight, giving him more of a line, which is already drawn in with his beard. So we know that the barbers even understand contour of a face. So that's where we want to go with that. And then lastly, a little bit into the temple. We just go directly down into the bone. Now there's a couple ways to do this, and I always tell people the temple is like a swimming pool. The upper portion is very superficial, that's the baby end, and then you walk all the way down here, and that's where you do the deep dive. So for example, the deeper portion of the temple is going to require much more volume. You're going to need to use something much more substantial there, like Radiesse, Juvederm Ultra Plus, Restylane Define, something to lift. But as you move more superficial up into the forehead, we can use cannula here, we can use superficial injection onto bone, and you want to use something a little softer that doesn't need as much volume. We could do small amounts of Bellafill here, or we could do something like Restylane Refine, or I typically try to avoid Juvederm unless it's Vicross technology up here because it's going to swell. It's going to look a little puffy. All right, let's keep going. So one more little dab. We're going to move a little bit more superficial into the temple. Let me show everybody here. Veins and arteries go here and here, so there's really nothing to worry about. It's in the central area. You go all the way down to bone. Small aliquot. And always just a little bit of pressure. Almost no bleeding. Sides complete. Looks good. So at least there's some volumization. Now remember, with Bellafill, we're not trying to get to full correction. So if the patient has, you have to really understand that these are the patients that want long-term relationships. If they've been in date after date after date and they can't hold on to a girlfriend, don't inject them with Bellafill. That's what I tell them, because honestly, they can't hold, they want immediate gratification. They're never going to be happy with this overall. So I'm going to do a little bit more laterally here to just give you a little contour, just a small amount. Good, and then we'll just finish on the other side. Yeah, you can just slide this back, because we have the time, so we might as well do it. So if we take a look at one side versus the other. Now we didn't address his under eye, one for product volume, but also because I wouldn't want to inject Bellafill up here, although there's sometimes that will dilute it a little bit more. I'll mix HA with Bellafill, and I frequently will do that actually for the under eye area, the hands, the chest, and actually the genital area. We do that very frequently for vaginal and penile rejuvenation. We use a small amount of Bellafill, collagen producing, mixed with HA. There's no reason you can't do that, and many companies are trying to create that product actually right now. But for this area, who feels he's a great candidate for filler? I'm just curious. You do. So in my opinion, he's not, actually. And I'll tell you why. If you look at his facial structure, he's super deficient in anatomy right here. He's very low maxilla. If you turn his head here, he's almost no facial support. He needs a cheek implant or eye surgery. He's the best candidate actually for surgery to actually get a full improvement. Now obviously as non-invasive doctors, we want to do things that make people look better. So if we want to make him look improved, we can do a little bit of filler. But if he really wanted the best result, you should be honest with him. You should say, look, you actually need eyelid surgery. Your eyelids are very low compared to where your cheek fat pads are. You can see the full orbital rim. The cheek fat pads all the way down here. There's no way you're ever going to get it up to here, where it should be. Okay, there's no way. Because if you do filler for that, remember, that's the old school way. That's numerous amounts of volume to lift a face, when a face cannot be lifted with filler. A face needs to be lifted with a facelift, energy devices, threads. Filler just does subtle lifting and a little bit of contouring, but it doesn't do full lifting. So he either needs fat injected here, or he needs a cheek implant, or he needs his eyelids done. As the ultimate result, that's the Ferrari with everything in it. But you want to take out some of those additions that get the BMW, then we're going to do a little bit of filler in here to soften the area, but it will never be 100%. And that's what you should tell him. So we'll go and we'll then go and dress from the top down. And you can see here now, if you take a look at both sides, let me just transfer it a little bit here. You can see the shadowing of his fusion line right here on the one side, but you cannot see that nearly as much on the other because we injected a few aliquots of the filler there. We're going to do that same thing up here. I'm putting my fingers both on both artery and vein so I can actually feel the pulse of his vessel right there all the way down to bone. How did that feel?
That is a very strange feeling.
Yeah, that's why I wanted to bring it up, because most people will say
It's not
that they hear it. Do they hear it, or they think it's going into their brain? But it's not. It's really not going into their brain, but it's getting close. No. We always tell people it's actually a safe area. You just have to go, you're going to feel it a little bit more. And we tell people that they may have some pain on chewing over the next few days afterwards because the muscle for chewing goes all the way up here. So we did that one injection. We're going to go a little bit more superior, directly down to the bone, through that muscle, just a small aliquot. And on this side, he has a little bit more, so I'm actually going to change the direction posterior and add a little bit more, a little bit of pressure, perfect. And you should do great. Great. Now we're going to go back to that same angle. We're going to look at where his cheekbone is. We're going to draw a line right there and go a little bit more superiorly. Not as much lateral as we would in a female. But this is just to give a little bit of structure to the sort of masculine cheekbone that we would want to create for him. Good. What does each feel like to you?
How it doesn't hurt, it's just kind of a weird sensation when it is going in, I guess.
Great.
It almost sounds and feels like grainy.
Yeah, like crunchy.
Yeah, crunchy.
Exactly, because we're going down to the bone, so we're going through the muscle. And so over here, we're going to draw out that 90 degree. I'm going to feel right at the angle of the mandible. We're going to go all the way down there. You know, sometimes you can actually inject a little bit in the subcutaneous area here, or use a cannula, just making it easy for us today. And then feeling in the back here, you can come close with the live if you want. Feeling in the back there, really trying to create that 90 degree by extending this superiorly. And then, do we have a little bit left? No. Okay, good, because I already did the chin. So perfect. So now that is subtle enhancement. We call it micro optimization in my practice. You can see just a little bit to the jawline, a little bit for widening of the chin, enhancement, which is more of a shadowing effect to the cheekbone here, which we didn't address mid-face today, and then a little bit into the temple. Now, if we were to go now, I would say, okay, let's layer other fillers to really finesse the results. So what I would do is I would use a cannula here and inject all through the temple area. I would inject a little bit to the mid-face here and soften through here, and then we'd be done. Then it would soften kind of all the areas, and we could layer or sandwich those products, because this product is deeper and is like the foundation of the house. That's the collagen building over time. So that was great. You did it. It was male facial optimization. Thanks for following, guys. So what do you guys want to add? Any questions?